Hello, everyone, and welcome to the Doc Vats channel.
Hey.
Here we dive deep into evidence-based topics on sports medicine.
Right.
And today, we're tackling a subject that's absolutely crucial for all of us working with elite athletes.
Okay.
Mental health.
Yeah.
You've sent us a ton of research and articles,
It's a hot topic.
and we're here to help you sift through it all
Definitely.
and extract the most important takeaways
It's great to be here.
for you in your practice.
It's a topic that's finally getting the attention it deserves.
Okay.
You know, for a long time, mental health was sort of the elephant in the locker room.
I knew it was there, but no one really wanted to talk about it.
Yeah.
And it was the...
Yeah, and I feel like,
takedown.
especially with athletes, there's this sort of,
Oh, yeah.
like, stigma around it.
Oh, absolutely.
It's a sign of weakness.
Yeah, you got to be tough.
Right.
You got to push through,
Right. Exactly.
And so I think there's that extra layer of...
Yeah.
like,
Absolutely. Difficulty in even addressing it.
Oh, yeah. There's so much pressure to be strong and to never show any vulnerability.
Okay, so let's unpack this elephant, shall we?
Let's do it.
The first thing that jumped out at me from all the research you guys sent was just how prevalent
Yeah.
mental health symptoms and disorders actually are in elite athletes.
It's really...
The numbers are way higher than I expected.
It is eye-opening.
Yeah.
One study found that a whopping 45% of elite male athletes in team sports
Wow.
reported experiencing symptoms of anxiety or depression.
45%.
Yeah.
That's almost half the athletes.
Yeah, it's crazy.
I mean, I knew it wasn't uncommon,
right.
but that's a staggering number.
It's a huge number.
Now we're just talking about males, too.
Right. And for female athletes, especially in sports that emphasize leanness,
Yeah.
like gymnastics or figure skating,
Right.
the rates of eating disorders can be even higher.
And that is
Yeah.
a whole other
Absolutely.
can of worms that we're gonna
We're going to get into.
we're gonna definitely unpack that.
Yeah.
But I think
It just goes to show you how important this issue is.
right, and it just underscores the need for all of us,
Yeah.
doctors, nurses, coaches, everyone
Involved.
to be more aware of these issues and to be proactive
Yeah.
in identifying and addressing them.
Absolutely.
Now, I know from my own experience working with athletes that it can be really tricky to differentiate between what's just part of the athlete mentality and what's actually a sign of a mental health problem.
Yeah, that's a great point.
These guys are super competitive, disciplined, and often driven by this no pain, no gain mindset.
Right.
So how do we tease apart those traits
Yeah.
from something that's truly a red flag?
That is the million-dollar question.
Right.
That's one of the biggest challenges we face as clinicians.
Yeah.
Take overtraining syndrome, for example.
Okay.
The symptoms, fatigue, irritability, sleep disturbances can look a lot like depression.
Okay.
But it's important to remember that overtraining is a physiological response to excessive physical stress,
Okay.
whereas depression is a mood disorder.
So an athlete who's just pushing themselves too hard physically
Right.
might exhibit similar symptoms to someone who's actually clinically depressed.
Exactly.
Okay. So how do
And so that's where, we have to dig a little deeper. Ask more questions.
Yeah.
Get a good history.
what are some of the things that you look for to kind of...
Yeah. So you want to look at the duration of the symptoms.
Okay.
How long have they been experiencing this fatigue, this irritability, these sleep disturbances?
Okay.
Is it related to their training load?
Okay.
Or is it something that's more persistent? Even when they're taking rest days.
Okay.
You want to look at their mood,
Okay.
their energy levels, their motivation.
Okay.
Are they still enjoying their sport?
Okay.
Or has it become a chore?
Those are all important clues
Okay.
that can help us differentiate between overtraining and depression.
And there are also tools
Yes.
like the Barron Depression Screener for athletes
Right.
that we can use
Exactly.
to kind of help us differentiate
Absolutely.
between those two.
It's a great tool.
Okay, so diagnosis is clearly a nuanced process.
It is.
Let's say we've identified an athlete who's struggling.
Okay.
What are some of the most effective approaches for managing mental health issues in this population?
Well, just like with any other health issue, it's important to take a holistic, personalized approach.
Okay.
There's no one-size-fits-all solution.
Right.
But generally speaking, psychotherapy is often the first line of treatment.
Okay.
And cognitive behavioral therapy, CBT, has shown to be particularly effective for athletes.
I've heard good things about CBT.
Yeah, it's a great therapy.
What is it about CBT that makes it so?
It's all about identifying and changing those negative thought patterns
Okay.
that can contribute to things like anxiety and depression,
Okay, so it's like you're recognizing those thought patterns and then actively working to change them.
You're challenging those thoughts.
Yeah.
You're reframing them.
Okay.
You're developing coping mechanisms.
And how is that specifically helpful for athletes?
Well, for athletes, it can be especially helpful in addressing things like performance anxiety or fear of re-injury.
Okay.
Helping them to develop a more positive and realistic mindset.
So you're giving them the tools to
Exactly.
kind of manage
Yes.
those negative thoughts.
Exactly.
Now, I know that medication
Right.
can also be part of the treatment plan,
Yes.
but I imagine there are some unique considerations
Oh, absolutely.
when prescribing to elite athletes.
There are definitely some things to keep in mind.
Okay. What are some of those things?
Well, first, we always have to consider the potential impact on athletic performance.
Okay.
Some medications can cause side effects like
Yeah.
drowsiness or weight gain
Okay.
that could be detrimental
Right.
to an athlete's training or competition.
Right. That makes sense.
Right.
You wouldn't want to prescribe something that's going to hinder their ability
Exactly.
to perform at their best.
Exactly.
Okay. What else?
And then there's the issue of therapeutic performance enhancement.
Okay.
This refers to the possibility that a medication, while effectively treating a mental health condition,
Okay.
might also indirectly improve an athlete's performance.
So, for example, if an athlete's depression lifts because of medication,
Right.
they might naturally have more energy and motivation, leading to better results
Exactly.
in their sport.
That's the idea.
Okay.
But it's important to be clear
Yeah.
that this is not about using medication
Right.
to gain an unfair advantage.
Right.
It's about treating the underlying condition,
Right.
which then allows the athlete to perform to their full potential.
Okay. And I'm guessing there are also ethical concerns
Huge.
about athletes using medications specifically for performance enhancement,
Huge ethical concerns.
even if they don't
Right.
have a diagnosed mental health condition.
Exactly. That's a whole other can of worms
Right.
that we need to be very careful about.
Yeah. We could do a whole deep dive
Oh, yeah.
on that topic.
Absolutely.
But I think
But the key takeaway here is that we have to be vigilant in making sure that medications are being used appropriately and ethically.
okay. So it sounds like there's a lot to consider
There is.
when it comes to
There's
medication.
a lot of nuances.
But let's move on to some specific mental health conditions that we often see in athletes.
That's good.
Sleep problems, for instance.
Uh-huh.
I'm guessing those are pretty common,
Oh, incredibly common.
given the demands of training and competition.
You're right.
Yeah.
Sleep is so essential for recovery and performance.
Right.
And yet athletes often struggle to get enough quality sleep.
Okay, so it's not just about the amount of sleep.
It's not just about quantity.
It's about the quality of sleep.
It's about quality, too.
Makes sense.
Are they getting deep, restful sleep?
Right. I mean, if you're constantly traveling across time zones,
Exactly.
training late at night, or dealing with the stress of competition, it's bound to take a toll on your sleep.
It's going to disrupt their sleep patterns.
Right. And then that lack of sleep
Yes.
contributes
It's a vicious cycle.
to more problems.
Absolutely.
Right.
The problem is that poor sleep can have a cascading effect on an athlete's physical and mental health.
Right. Okay.
It can impair cognitive function, increase injury risk, and even contribute to mood disorders like anxiety and depression.
So it's really important to address sleep issues head on.
Absolutely.
How do you go about that?
Well, the first step is to rule out any underlying sleep disorders,
Okay.
like sleep apnea or restless leg syndrome.
Okay.
Those are medical conditions that
Oh, yeah.
need to be addressed by a doctor. But once we've ruled out those,
Uh-huh.
then we can work with athletes to develop good sleep hygiene habits.
Okay. What are some examples of good sleep hygiene?
Like creating a relaxing bedtime routine,
Okay.
avoiding caffeine and alcohol before bed,
Okay.
and making sure their sleep environment is dark, quiet, and cool.
Okay. So,
Those basic things can make a big difference.
so we've covered sleep.
Uh-huh.
Now, what about depression?
Okay.
I know it's a serious issue in the general population.
Right.
Are there any specific challenges or considerations when it comes to diagnosing and treating depression in athletes?
Yeah, one challenge, as we discussed earlier, is differentiating depression from overtraining syndrome. But there's also the issue of stigma.
Right.
Athletes are often reluctant to admit they're struggling with depression
Yeah.
because they fear it will be seen as a weakness or that it could jeopardize their career.
That's so unfortunate.
It is.
That's like they're trapped in this culture
Yeah,
where they're expected to be tough
right.
and never show any vulnerability.
Exactly. And that's why it's so important
Right.
to create a safe and supportive environment. Okay.
where athletes feel comfortable opening up about their struggles.
Okay.
We need to let them know that it's okay to ask for help
Uh-huh.
and that seeking treatment is a sign of strength, not weakness.
And that's where we, as sports medicine professionals,
Yeah.
can really make a difference.
We're in a unique position to build trust with athletes
Yeah.
and encourage them to prioritize their mental health.
Absolutely. Okay, so depression is on our radar.
Right.
What about anxiety?
Okay.
I'd imagine that's pretty prevalent among athletes,
It is.
given the pressure to perform at such a high level.
It is incredibly prevalent.
Yeah.
You'd be surprised how many different types of anxiety we see in athletes.
Oh, really? Like what?
There's generalized anxiety disorder,
Uh-huh.
social anxiety,
Okay.
panic disorder,
Okay.
specific phobias,
Okay.
you name it.
Wow.
And then there's performance anxiety,
Yeah.
which is almost universal among athletes to some degree.
Well, performance anxiety makes sense.
I mean, who hasn't felt butterflies
Exactly.
before a big game or competition?
Right.
But when does that normal pre-game jitters
Yeah, that's a great
cross the
point.
line into something more serious?
It's all about the intensity and the impact.
Okay.
If the anxiety is so severe that it's interfering with the athlete's ability to train, compete, or even enjoy their sport,
Okay.
then it's a problem that needs to be addressed.
Okay. And how do we go about treating anxiety in athletes?
Well, CBT can be very effective in helping athletes manage their anxiety symptoms.
Okay.
We teach them techniques like deep breathing,
Uh-huh.
progressive muscle relaxation,
Okay.
and mindfulness to help calm their nerves and reframe their negative thoughts.
I've heard great things about mindfulness.
It's a great technique.
What is mindfulness?
It's all about being present in the moment
Okay.
and letting go of those worries about the past or the future.
Okay, so you're just kind of focusing on the here and now.
Exactly. And for athletes, it can be especially helpful in improving focus and concentration,
Right.
which are obviously essential for peak performance.
Right, absolutely.
Yeah.
Okay, so we've talked about sleep problems,
Uh,
depression,
Right.
and anxiety.
Yes.
What are some other mental health conditions
Uh,
that we should be aware of?
One condition that's often overlooked but can have a significant impact on athletes is post-traumatic stress disorder, or PTSD.
PTSD.
Yeah.
I thought that was something that mostly affected combat veterans
Right.
or survivors of violent crimes.
Yeah, you're right that PTSD is often associated with those types of trauma.
Right.
But athletes can experience trauma too.
Oh, okay.
You know, they might witness or be involved in a serious accident during competition.
Right.
They might suffer a career-ending injury
Yeah.
or even experience abuse from a coach or teammate.
I hadn't really thought about it that way before.
Yeah,
So the trauma doesn't have to be combat related.
it doesn't.
It can be anything
It can be any event.
that's perceived as life-threatening
Right.
or deeply disturbing.
Exactly. And the symptoms of PTSD can be quite varied.
Yep.
Athletes might have flashbacks,
Uh-huh.
nightmares,
Okay.
intrusive thoughts,
Mhm.
difficulty sleeping,
Okay.
irritability, or even emotional numbness.
Okay.
So it can manifest in many different ways.
And I imagine that the tough it out mentality
Yeah,
that's so prevalent in sports
absolutely.
might make it even harder for athletes to
It makes it much harder.
recognize
Yeah,
and seek help
exactly.
with PTSD.
They might be afraid to admit they're struggling or worry that it will make them look weak.
So it's crucial that we,
Yeah.
as sports medicine professionals,
Uh-huh.
create an environment
Yes.
where athletes feel safe and supported
Absolutely.
in talking about their mental health.
We need to create a culture of openness
Yeah.
and support.
Now, shifting gears a bit,
Okay.
I know that eating disorders
Uh-huh.
are a major concern, especially among female athletes.
Especially in certain sports
Yeah.
that emphasize leanness.
What are some of the key things we need to be aware of in that area?
Well, eating disorders are incredibly complex.
Okay.
And they can have devastating consequences
Yeah.
for an athlete's physical and mental health.
Okay.
We see a range of eating disorders in athletes, including anorexia nervosa,
Uh-huh.
bulimia nervosa,
Okay.
and binge eating disorder.
Okay.
And the prevalence rates are alarming,
Yeah.
particularly in sports that emphasize leanness,
Like what kind of sports?
like gymnastics, dance, and distance running,
Okay.
where there's a lot of pressure to be thin.
And I've heard that the pressure to maintain
Oh, yeah.
a certain body weight or shape
It's a miss.
and be in
It can be relentless.
in those sports.
And it's not just about aesthetics.
Okay.
Athletes might believe that being thinner will make them faster,
Okay.
stronger, or more agile.
Uh-huh.
But in reality, restricting calories and nutrients can have the opposite effect, leading to fatigue,
Okay.
weakness, impaired performance, and even serious medical complications.
So it's this vicious cycle.
It is.
They're restricting to improve performance.
Right.
But it actually ends up hurting them in the long run.
Exactly.
And that's why it's so important to educate athletes about the dangers
Absolutely.
of disordered eating.
Wait, to educate them?
And to promote a healthy body image.
Yes, we need to shift the focus from weight to health and performance.
Okay.
Help them understand that their worth is not tied to their size.
And I imagine that early identification and intervention are key.
Oh, absolutely.
When it comes to eating disorders.
The sooner we can catch and treat these conditions, the better the outcomes tend to be.
But it can be challenging to identify.
It can be very challenging.
Eating disorders in athletes.
Yes.
Because they're
very good at hiding it.
Go to great lengths to hide their behaviors.
Exactly.
Okay, so we need to be
vigilant.
Attuned to the subtle signs and symptoms.
Right. What are some of those?
Signs like changes in eating habits, excessive exercise, preoccupation with weight, or social withdrawal.
Those are all red flags.
And it's important to remember that eating disorders are not just about food and weight.
They're not.
They're often a coping mechanism for underlying emotional distress.
Exactly.
Like anxiety, depression, or trauma.
Exactly.
So treating the eating disorder effectively often requires addressing those underlying issues as well.
It's a multifaceted problem that requires a multidisciplinary approach involving not just mental health professionals, but also physicians, nutritionists, and even coaches.
Okay, we've covered a lot of ground already.
We have.
But there are a few more conditions
I
want to touch on.
Sounds good.
ADHD, for instance.
Oh, okay.
How does that play out?
Interesting topic.
In the world of elite athletics.
ADHD can be both a blessing and a curse for athletes.
Oh, really?
It can, on the one hand, the hyperfocus and impulsivity associated with ADHD can actually be advantageous in some sports. Leading to quick reactions and bold decision-making.
So an athlete with ADHD might excel in a sport like basketball.
Exactly.
Or hockey. Where split-second decisions are crucial.
Exactly, where they can just react and not overthink things. But on the other hand, those same traits can also be detrimental.
Okay, how so?
The impulsivity can lead to risky behavior or difficulty following rules. And the inattention can make it hard to focus on training or to execute complex game plans.
So it's a double-edged sword.
It really is. So it's important to understand the individual athlete and how their ADHD is affecting them, and then develop strategies to help them manage their symptoms.
What are some of those strategies?
Well, the treatment for ADHD in athletes often involves a combination of behavioral therapy and medication. But there are, of course, ethical considerations when it comes to using stimulant medications in a population where performance enhancement is always a concern.
We have to be very careful about that.
Absolutely.
Now, what about substance use?
I
know it's an issue across society.
It is.
But are there any specific trends or challenges we see in athletes?
Substance use is definitely a concern in the athlete population. We see everything from alcohol and marijuana use to performance-enhancing drugs and even opioids.
I've heard that binge drinking is a particularly big problem.
It is.
Among college athletes.
It's a huge problem.
Why is that?
Well, the culture of partying and celebrating athletic victories can normalize excessive drinking. Making it harder to recognize when it's become a problem.
And I imagine the pressure to perform and the physical demands of training can also lead some athletes to seek out.
Absolutely. They're looking for ways to cope.
To cope with stress or pain. And
of course, there's the issue of performance-enhancing drugs.
Right.
Which is a whole other ethical and legal quagmire.
Right. And we could do a whole other deep dive.
Absolutely.
Just on that topic.
We could talk about that for hours.
But for now, let's move on to one final condition.
Okay.
I want to ask you about gambling disorder.
All right.
Is that something we see in athletes?
Gambling disorder is more common than you might think.
Really?
And athletes are certainly not immune.
Okay.
In fact, the competitive nature of sports and the thrill of risk-taking can actually make some athletes more vulnerable to developing a gambling problem.
And I imagine the easy access to online gambling platforms has made it
It's everywhere.
Even more accessible and potentially addictive.
Absolutely. It's so easy to get caught up in it. And the problem is that gambling disorder can have devastating consequences for an athlete's finances, relationships, and even their career.
So it's something we need to be aware of and screen for?
You do.
Just like any other mental health condition?
It's part of our job.
And it's important to remember that gambling disorder often co-occurs.
It does.
With other mental health issues like anxiety and depression.
Absolutely.
Making it even more crucial.
It's a comorbidity we see quite often.
Yeah.
So we have to be on the lookout for that.
To identify and address it early on.
Early intervention is key.
Okay, so we've covered a wide range of mental health conditions that can affect athletes.
It's a lot to take in.
Now let's shift gears and talk about the role of the environment.
Okay.
In supporting or hindering athletes' mental well-being.
Sounds good.
What are some of the key factors that can impact an athlete's mental health?
Well, one of the most significant factors is the culture of the team or organization. If there's a culture of open communication where athletes feel comfortable talking about their struggles and seeking help, then that's a huge protective factor.
So it's about creating an environment where mental health is prioritized and normalized.
Normalized, not stigmatized.
Not stigmatized.
Right.
Okay, that makes sense.
It's about creating a safe space.
But how do we create that kind of culture?
Yes.
It's not like you could just flip a switch and suddenly everyone's open and honest about their feelings.
You're right. It takes time and effort.
Okay.
But it starts with leadership.
Okay.
Coaches, trainers, and administrators need to set the tone by being open about their own mental health struggles and by encouraging athletes to seek help when they need it.
So it's about modeling vulnerability.
It is.
And normalizing mental health care.
Exactly.
And it's also important to provide athletes with opportunities to talk about their mental health in a safe and supportive setting.
Absolutely.
Like team meetings.
Yeah, team meetings are a great opportunity.
Or individual check-ins.
Individual check-ins are good too.
Yeah.
Or even just casual conversations.
Okay.
You know, just checking in with them, seeing how they're doing.
Yeah.
The key is to create a space where athletes feel like they can be themselves and that they won't be judged or ostracized for struggling.
Now, beyond creating a culture of open communication, are there any other practical steps
Yes, there are.
we can take to support athletes' mental health?
One thing that's really helpful is to provide athletes with access to mental health professionals.
So having a sports psychologist or a therapist on staff?
Ideally, yes.
Okay.
But if that's not possible, then at least having a list of referrals for qualified mental health providers who specialize in working with athletes.
That makes sense. Athletes have unique needs and challenges.
They do.
So it's important to find someone
Exactly.
who understands the demands of their sport and lifestyle.
Yeah, someone who gets it.
Right.
Someone who speaks their language.
Okay. And another thing we can do is to implement mental health screenings as part of routine physicals.
That's a great idea.
So just like we check their blood pressure and heart rate, we also ask them a few questions about their mental well-being.
Exactly. Just a quick check-in.
Yeah.
To see how they're doing mentally.
It also sends the message.
It does.
The mental health is just as important as physical health.
Exactly. Host, speaker, welcome back, everyone.
It's great to be back. Now, before the break, we were talking about mental health emergencies in athletes.
Right.
And that got me thinking about the link between mental and physical health. I mean, it's pretty obvious that if you're struggling mentally, it's going to affect your physical performance.
It goes both ways.
Right.
It's not just about performance, though.
Okay.
Mental health can also impact an athlete's risk of injury. Oh, interesting.
Yeah.
How so?
Well, think about it. If you're anxious or depressed, you're probably not sleeping well.
Right.
You might not be fueling your body properly.
Okay.
And you're likely more susceptible to stress.
All of which can weaken your immune system.
Exactly.
And make you more prone to getting sick or injured.
Exactly. And then there's the psychological side of things.
Okay.
If you're not mentally focused, you're more likely to make mistakes or take risks that could lead to injury.
So it's a two-way street.
It is.
Mental health can affect physical health.
Absolutely.
And vice versa.
For example, a serious injury can lead to depression or anxiety, which can then delay the healing process.
It's like a vicious cycle.
It can be, which is why it's so important to address both the physical and psychological aspects of injury.
Right. Okay. So we've established that mental and physical health are interconnected.
They are.
Now, what can we do to create a more mentally healthy environment for athletes? We talked about education and awareness.
Right. But are there any other specific strategies we can implement?
One thing that's really important is to foster a culture of open communication.
Okay.
Athletes need to feel comfortable talking about their mental health without fear of judgment or reprisal.
That makes sense.
Right.
But how do we create that kind of culture?
Right.
It's not like you can just flip a switch and suddenly everyone's open and honest about their feelings.
You're right. It takes time and effort.
Yeah.
But it starts with leadership.
Okay.
Coaches, trainers, and administrators need to set the tone by being open about their own mental health struggles.
Okay.
And by encouraging athletes to seek help when they need it.
So it's about modeling vulnerability.
It is.
And normalizing mental health care.
Exactly. And it's also important to provide athletes with opportunities to talk about their mental health in a safe and supportive setting.
Like team meetings or individual check-ins.
Yeah, team meetings are a great opportunity. Individual check-ins are good too. Or even just casual conversations, Just checking in with them, seeing how they're doing. The key is to create a space where athletes feel like they can be themselves. And that they won't be judged or ostracized for struggling.
Right. Now, beyond creating a culture of open communication,
Okay.
are there any other practical steps we can take to support athletes' mental health?
Yes, there are. One thing that's really helpful is to provide athletes with access to mental health professionals.
So having a sports psychologist or a therapist on staff?
Ideally, yes. But if that's not possible, then at least having a list of referrals for qualified mental health providers who specialize in working with athletes.
That makes sense. Athletes have unique needs and challenges, so it's important to find someone who understands the demands of their sport and lifestyle.
Yeah, someone who gets it, someone who speaks their language.
Right. And another thing we can do is to implement mental health screenings as part of routine physicals.
That's a great idea.
So just like we check their blood pressure and heart rate, we also ask them a few questions about their mental well-being.
Exactly. Just a quick check-in to see how they're doing mentally.
And it also sends the message that mental health is just as important as physical health.
Exactly.
Okay? So we're normalizing it.
We are.
We're saying this is
part of overall health.
Part of your overall health.
Right.
We need to be checking in on it.
Absolutely.
Now, in addition to providing direct support to athletes, it's also important to work on educating coaches and administrators about mental health.
It is.
Why is that so important?
Because they're often the ones who are in the best position to identify and support athletes who are struggling.
That makes sense.
Yeah.
They're the ones who see the athletes day in and day out.
Exactly. So we need to make sure they have the knowledge and the skills to recognize the signs of mental health problems and to respond appropriately.
So what kind of training should they receive?
Well, they need to learn about the different types of mental health disorders, the symptoms to look out for, and the resources that are available. They need to know how to have those difficult conversations in a way that is supportive and non-judgmental.
It's a lot to ask of coaches.
It is.
But it's so important.
It's crucial. And it's not just about coaches. Administrators also need to be educated about mental health so they can create policies and procedures that support athletes' well-being.
Right. So like a top-down approach.
It is. We need buy-in from everyone.
Okay. What about technology? What role can technology play in supporting athletes' mental health?
Technology can be a powerful tool for both good and bad when it comes to mental health.
How so?
Well, on the one hand, social media can contribute to anxiety, depression, and body image issues.
That's true. The constant pressure to present a perfect image and the negativity that can breed online can be really damaging.
Right. It can be toxic.
Yeah.
But on the other hand, technology can also be used to deliver mental health services and connect athletes with support.
So things like therapy apps,
yes,
online support groups, and even virtual reality programs.
Exactly. And these technologies can be particularly helpful for athletes who might be reluctant to seek traditional in-person therapy.
That makes sense. They might feel more comfortable talking to someone online or using an app where they can remain anonymous.
Right. It can feel less threatening. Plus, technology can also be used to track athletes' mental health over time.
So like a mood tracker or a sleep tracker.
Yes. This data can be really helpful in identifying patterns and trends that might indicate a problem.
So it's like we're getting objective data.
Exactly.
On their mental well-being.
Exactly. Which can be really valuable.
So it sounds like technology can be a valuable asset in our efforts to support athletes' mental health.
It definitely can be. But we need to be mindful of the potential downsides and use it responsibly.
This has been a really insightful discussion. I'm feeling much more equipped to address mental health issues with the athletes I work with.
That's great to hear.
But before we wrap up, I'm curious to hear your thoughts on the future of mental health in elite athletics.
Okay.
Where do you see this field going in the next 5 to 10 years?
I think we're going to see a continued shift towards a more holistic and integrated approach to athlete care.
What do you mean by that?
I think we're moving away from the traditional model where physical health and mental health are treated as separate entities.
So more of a mind-body approach.
Exactly. We're recognizing that mental health is just as important as physical health for athletic success and overall well-being.
And I think we're also going to see a greater emphasis on prevention.
Absolutely. We need to start addressing mental health issues early on, before they become major problems.
So things like mental health education in schools.
Yes.
Youth sports programs.
Yeah.
And even at the professional level.
Exactly. We need to normalize the conversation about mental health and make it clear that it's okay to ask for help.
And we also need to create a culture where athletes feel comfortable seeking help without fear of stigma or reprisal.
I completely agree.
It sounds like we have a lot of work to do.
We do.
But I'm optimistic about the future.
Me too. I think we're on the right track.
Well, that's all the time we have for this part of our deep dive into mental health in elite athletics.
Okay.
In the final part, we'll be talking about some of the challenges and opportunities facing the field.
Right.
And we'll leave you with some thought-provoking questions to consider.
Sounds good.
Join us then. Welcome back to the show, everyone.
Good to be here.
You know, it's fascinating to me how much our understanding of mental health in athletes has evolved, even in the past few years. There's been a real shift in the conversation.
Definitely. I think there's a growing recognition that mental health is not a weakness. It's a crucial part of overall well-being, and it directly impacts an athlete's ability to perform at their best.
And I'm curious, with this new understanding, are there any emerging areas of research or innovation that have you particularly excited? What's on the horizon for mental health support in elite sports?
There's so much exciting work being done right now. One area that's particularly promising is the use of technology to deliver mental health services. We're seeing a rise in the development of apps, online platforms, and even virtual reality programs designed specifically for athletes.
I've heard a bit about those. It seems like they could be really helpful for athletes who might be hesitant to seek traditional therapy, maybe due to stigma or just the busy demands of their schedules.
Exactly. They offer a level of anonymity and convenience that can be really appealing. Plus, they can be tailored to address the specific needs and challenges that athletes face.
So it's not just generic mental health advice. It's actually targeted towards the unique pressures of competing at an elite level.
Exactly. And another area of research that I'm really excited about is the focus on personalized approaches to mental health care.
What do you mean by personalized?
It's about recognizing that every athlete is different. They have different personalities, different coping mechanisms, different triggers, and different needs.
So a one-size-fits-all approach isn't going to cut it.
Definitely not. We need to move away from that and start tailoring treatment plans to the individual athlete.
That makes a lot of sense. It's about meeting the athlete where they're at and providing them with the specific support they need to thrive.
Precisely. And that might involve a combination of different therapies, medications, lifestyle changes, and support systems.
It sounds like the future of mental health care in sports is all about personalization, precision, and proactive support.
I think that's a great way to put it.
Now, as we wrap up this deep dive into mental health in elite athletics, I want to leave our listeners with a few key takeaways.
Sounds good.
First and foremost, mental health is just as important as physical health for athletic success and overall well-being. We can't afford to ignore it or treat it as a secondary concern.
I couldn't agree more. It's time to break down the stigma and make mental health a top priority in sports.
And that involves creating a culture of open communication where athletes feel comfortable talking about their struggles and seeking help when they need it.
Absolutely. We need to move away from the tough-it-out mentality and foster an environment of support and compassion.
And we, as sports medicine professionals, have a crucial role to play in this. We need to be educated about mental health, be proactive in screening for problems, and be prepared to connect athletes with appropriate resources.
It's our responsibility to advocate for athletes' mental health and to ensure they have the support they need to thrive both on and off the field.
And finally, I want to encourage all of you listening to think about what you can do to champion mental health awareness and support in your own sphere of influence.
Whether you're a coach, a doctor, a trainer, an administrator, or even a parent, you have the power to make a difference.
Let's all work together to create a world where mental health is prioritized and every athlete feels safe and supported in seeking the help they need.
I'm in.
That's all the time we have for today. Thanks for joining us for this deep dive into mental health in elite athletics. We hope you found it informative and empowering. Remember, you're not alone in this. We're all in this together.
Until next time, take care.